My name is Suzie Bash. I am Medical Director of Neuroradiology at San Fernando Interventional at RadNet. RadNet is the largest outpatient imaging enterprise in the United States. So we have 355 imaging sites spread across 7 states on both the East and West Coasts. We do about 8 million outpatient exams a year, 8,500 employees, and over 800 radiologists. One thing that I think drew RadNet to Subtle Medical, it allows basically a vendor-neutral product. And this is very, very important when you have a large imaging enterprise with a diverse fleet. Every large imaging enterprise is going to have a whole portion of new scanners and legacy scanners. And the advantage of SubtleMR is it's DICOM based, so it's vendor neutral and allows essentially a virtual scanner upgrade to all of those legacy scanners. We also apply it to our new scanners as well, versus the original equipment manufacturers which operate in case space. Those can really only be applied to their newer scanners and obviously limited only to that vendor. So it's really a tremendous advantage of working with SubtleMR. Another big advantage of using deep learning for image reconstruction, in particular SubtleMR, is it allows us to scan patients 50 to 75% faster. 30% of all patients have a severe anxiety reaction when they go into the MR scanner. And if you poll patients, which we've done, they will actually rate their #1 most important component of their imaging experience is how fast we can get them in and out of the scanner. You know, if we can scan patients faster and increase our capacity and throughput, that also means that patients theoretically don't have to wait as long to have their MRI scan obtained, which leads me to another advantage, and that's really increased workflow efficiency. This has a lot of operational impact, but also it can compensate for things like staff shortages. You know, if we can get patients in and out faster, you know, theoretically your workday could be shorter, your staff may not have to have as much overtime, and so that can make their life better as well. It also helps us improve our adherence to scheduling. Patients really don't like when they come in on their exam time and they're left to languish in the waiting room. So maintaining an efficient work schedule really increases patient satisfaction as well to reduce that wait time. We were very pleasantly surprised about the seamless implementation, and this was sort of all done over the cloud, and we really didn't see any impact or disruption to our workflow at all. SubtleMR deployment started in 2021. And Dr. Lawrence Tannenbaum calculated our data summary of what we've been able to achieve internally as an organization at RadNet. So we started calculating at the full year time scale. So in 2022, we found that we have been able to save 1.6 million minutes. And then what we project in 2023 as we continue implementation throughout the enterprise is that we will be able to save approximately 3 million minutes over the course of the year. And so that translates to being able to scan 33 to 55% more patients per day. And obviously that is a very positive ROI for us as an imaging enterprise. Working with Subtle Medical has been a real privilege for me. It's amazing what this company is doing and the impact that it's having to make patients' lives better. It's not just SubtleMR, which we use at RadNet, but they have several products in development that are very, very exciting. So for example, SubtleSynth allows essentially 100% acceleration because you can use deep learning to synthesize a sequence. And the bottom line here is it really is a win for everyone. It's a win for imaging enterprises because they can scan more patients a day. It's a win for radiologists because we get better image quality, and hopefully that will help us improve our diagnostic accuracy. And most importantly, it's a win for the patient because it really improves their comfort and their satisfaction in their imaging experience.